Thank you all for joining us this afternoon, and we hope you're keeping safe and indoors wherever you are. We understand that this is a difficult time for all of us, and we're more than grateful for everyone who's being able to be here for this conversation. Today, we have with us Aditi from IDinsight, who will be sharing her research findings from the study on implementation of the Take Home Ration program during COVID-19 and the way forward. In this session, Aditi will be presenting findings from a qualitative survey conducted to understand the challenges in the implementation of Take Home Ration program. The findings will also talk about the challenges by the frontline workers, perceptions of the beneficiaries, and the different Take Home Ration distribution models during the pandemic. But before I hand it over to Aditi, I would like to quickly go over some of the housekeeping rules. We are recording this session for the purpose of documentation and dissemination. And please let us know by chat if you would like to not be recorded or quoted, and we'll make a note of that. In the interest of active consent seeking, we will be removing all AI note-taking assistants joining this call. To save bandwidth on call, we would request you to please turn off your cameras and keep yourself in mute when you're not speaking. You can also speak or ask questions in Hindi or English based on your comfort. And please feel free to reach out to our team for any translation support. Please also use the chat box to leave your comments and questions, and we would encourage you to do so. And it would be great if you could also introduce yourself and your organization so that we know what context you're coming from when you're asking that question. Moving on, I will quickly share a little about CONET and the COVID Research Network. We came together last year in May at the back of the COVID-19 pandemic, and we aim to build a community of practice to foster exchange and collaboration among research organizations gathering information on issues that are relevant and pertinent to the COVID-19 pandemic in India. And throughout the last year, we've really grown in number, and we're around 60 plus members, member organizations who are working across 23 geographies in India. We have a vibrant workspace on Slack with over 200 members, and also a web platform with over 80 plus research projects from our members. We've also conducted several conversations, including coffee hour sessions and ethics dialogues over the past year. And we are now finally coming together for the CONET Conference 2021 that seeks to bring together the community and other pertinent stakeholders from the larger ecosystem to discuss learnings and experiences from the past year and for the future directions. And finally, without taking up any more time, I would like to introduce our speaker for the session today. Aditi is a manager at IDinsight who has led numerous projects that promote greater use of data and evidence-based policy design. She has worked on multiple engagements with Niti Aayog and state governments, focusing on building platforms for higher data use while working in the health and nutrition sector. Previously, Aditi managed multiple evaluations in the energy sector at JPAL. She holds an integrated master's degree in economics from IIT Kanpur. We're very happy to have you with us today, Aditi, and we're looking forward to this conversation. With that, I'll hand it over to you.
Cool. I hope my screen is visible. And yeah, I just want to thank CONET for providing this opportunity. I guess it's very important to discuss all the work which has been done during this time last year. And we have some interesting results here for everyone to know. Also want to acknowledge the efforts of our team and the field and enumerators, the hard work which has gone in curating these findings. Last but not the least, the support from Children Investment Fund Foundation and DIO in enabling us to conduct this study. Okay, so my presentation is structured in 5 points. So background of our study, what is the context of it, then the 3 main insights which we've drawn from our study, and then a detail about each of those insights as to how we ended up concluding those. So what is Take Home Ration, and often abbreviated as THR? So Take Home Ration is a key program under the Supplementary Nutrition Program under the Integrated Child Development Services. Under this program, the pregnant women, lactating women, and young children are provided nutritious, micronutrient-rich meals to help them grow in this critical phase of their life. And this becomes quite a bit important during the current scenario of COVID, which has disrupted so many food systems and the supply chains worldwide, as well as in India. So it is extremely important at this point in time for us to know the details about Take Home Ration and how those supply side and demand side barriers are being there due to COVID. Second thing why we wanted to focus on Take Home Ration was we are focusing on 2 states, Rajasthan and Jharkhand, and both of the states implemented new production and distribution model in the last 12 months. And this study provided us an opportunity to understand deeper in terms of the differences between the two models and which one performs better. Thirdly, before this qualitative study, we did two extensive rounds of quantitative surveys to understand the coverage of THR and a lot of other health and nutrition service delivery things. And our pre-post analysis showed that the THR access dropped in both the states due to the lockdown. So during the lockdown, maybe partially due to COVID, maybe partially due to other factors. But we observed a 5 percentage point drop in Rajasthan and a 12 percentage point drop in Jharkhand. Also, the district variation was quite a bit among these two states. So all to say that learnings from the study, which was conducted last year, can help government in THR programming in the current wave of COVID. So a little bit more about our study. What did we do? We chose two states, as I was saying, Rajasthan and Jharkhand. And across these two states, we picked up 12 districts, 7 in Rajasthan and 5 in Jharkhand. And the district selection was done in a manner that our data was state representative. Once we had done the selection, we chose our respondents who we wanted to speak with, and those were divided across two categories. One is supply side functionaries, and second is demand side beneficiaries. So on the supply side, we spoke to Anganwadi workers, 27 in Rajasthan and 27 in Jharkhand. We also spoke to 6 self-help group members in Jharkhand who form a key part of the supply chain there. And then on the demand side, we spoke to 27 pregnant and lactating women in Rajasthan and the same number in Jharkhand. So overall, we spoke to more than 100 respondents in both of these two states, and the survey was conducted in August. The survey was completely remote, was done through phone survey setting by a team of trained enumerators, and went through certain steps before we could reach our final analysis. Two main research questions which we were targeting through this survey is, one, what are the supply side challenges of delivering THR, along with the change in the models in the two states, plus the COVID? And second, what are the demand side challenges in accessing and utilizing that THR for the beneficiaries in the current COVID scenario? A little bit about the process we followed after the data was collected. So as I was mentioning, we did phone interviews, which lasted about 30 to 45 minutes, which was followed with transcription and translation and entry into spreadsheets. And then once we had all the data in spreadsheets, we did paraphrasing of those data, further followed by theme coding, and then finally analysis to result in our findings and narrative. Okay, so let's talk about our 3 key insights. And the 3 key insights which we are proposing to improve the THR program in second COVID wave are, first, addressing delays in funding and payments. And this is specific insight from the supply side functionaries. Second is providing procurement support, again, for the supply side functionaries. I'm going to talk into detail about each of these soon. And third is to enhance trust and communication with the beneficiaries. So we're going to just fill this slide as we go in my presentation to understand how we are recommending these insights. Before we do that, however, let me just give you a brief overview in terms of what is the THR model in Jharkhand and how it is different from that in Rajasthan. So in Jharkhand, it is a decentralized model. What that means is that there are local self-help groups which are run by women, which are present at a community level, who are responsible for procurement, production, and packaging of THR, and they're also for distributing them from their centers to Anganwadi centers. And then the Anganwadi workers are responsible for distributing it further to the beneficiaries. So it is a very decentralized model which runs at a local level. And in Jharkhand, THR is composed of 5 items under the basket: rice, lentils, jaggery, peanuts, and potatoes. And these are all delivered as dry ration to the beneficiaries. Now, Rajasthan is slightly quite different in a way that it is a centralized model. So in Rajasthan, what happens is that the state is responsible for procuring THR items and transporting them to the fair price shops or the PDS ration shops. And then from there, it goes to the Anganwadi centers, and then the Anganwadi workers distribute it to the beneficiary. So the state is responsible for maintaining the quality and controlling basically the procurement of THR. And this model actually was adopted as soon as the lockdown went into 2020 in April to fight with the impact of COVID and lockdown. And they also therefore had only 2 items in their baskets, which was either wheat or rice, depending upon availability, and then lentils. So both of these models are slightly different, but we will see that the findings which we come across are quite similar in the 2 states. Okay, so let's discuss our first insight. And here, let's talk about Jharkhand first. So here what we observed was that the self-help group members and Anganwadi workers reported to not receive payments on time. So what was happening is, as I was mentioning, self-help group members are supposed to procure the THR items locally. And once they have procured that, they are supposed to file the reimbursements with the government. And that is where the problem comes in, because either those reimbursements are delayed or they're skipped. And because of that, the supply chain breaks. And therefore, it's a cascading effect where, the THR doesn't get delivered for the subsequent months as well. Second problem in Jharkhand was that since they had to locally procure the THR items and then get reimbursed later, the price may differ between what the market is offering versus what they are being reimbursed by the government. So this price difference often inhibited them to purchase the products which were expensive in the market, and they had to then pay out of their pocket. In Rajasthan, even though it was a central process where the state was responsible to provide ration at the PDS shops, what happened in the beginning of the lockdown was that the ration was often not there, and Anganwadi workers had to turn to the local market. And when they did purchase from the local market to meet the demands of the beneficiaries, they were often either partially reimbursed or the reimbursements were delayed, so which led to an impact in their supply chain. So the quote here actually says that it is difficult for the Anganwadi workers to balance both sides, right? So they are also being pressured by the public to give the ration, and then they are also not being paid on time by the department. But they are sort of stuck in the middle to meet the both sides and are working towards it endlessly still. The quote was much more powerful, but I hope we all got what I was trying to say. So that was the first insight, and what we did was we also wrote some of the key next steps which could be taken to actually address this challenge, which is funding and payment. So the first thing which we recommended to Jharkhand is to move to a prepaid system, which is, allow the functionaries to take advance from the government to be able to procure these items for the upcoming months and not rely on a reimbursement process. That will provide them enough capital to move on. The second is, which is for both the states, is setting up an e-payment system for the ICDS, as well as including the self-help group members. Having an electronic system on the basis of technology and upcoming softwares can help in fast processing of the challan receipts, etc. And the third is that the prices definitely should be matched on what they are being reimbursed with the market price. Okay, so let's move on to the second insight, which is providing procurement support, and how did we come about that? So first, talking about Jharkhand. So just to remind you, there were 5 items under Jharkhand's THR basket: rice, lentils, jaggery, peanuts, and potatoes. And what this graphic tells you is that we asked the beneficiaries the question of what items did they receive under THR in the last 9 months since we were surveying. And this is what we got. So basically, rice was delivered on all the months. And you can see that peanuts and potatoes were very less delivered, lentils and jaggery almost there. So the reason is, for peanuts, actually, what we understood from our surveys was that peanuts prices were pretty high in the local market. And as I was saying, self-help group members were not reimbursed at that same price. So they stopped procuring peanuts after a point. And then potatoes had different problems, which was around rotting. So potatoes rot easily, and therefore they were difficult to store, and so were not delivered after December. They were just delivered once. And this model actually came into effect in November. So even though the basket is pretty varied and has a lot of items, not all beneficiaries receive all of them. Then in Rajasthan, similar challenge, but slightly different. We also did the same questions in Rajasthan, and what we saw, as there are 2 items in Rajasthan's basket: pulses and wheat. And we saw that pulses were more available and distributed, whereas wheat definitely had a lot of procurement challenges. So firstly, when the lockdown came into effect in April, The Anganwadi workers were instructed to purchase wheat and pulses locally. As you can see, we've marked it out. Then in May, the procurement problems increased further because they were instructed to purchase wheat from the schools under the midday meal quota and continue buying pulses from the local market. So you can see the lot of confusion which might have come in during this month, and all the responsibilities being on the Anganwadi workers. Then from June onwards, it went to where it should have been, to the BDS shops, and procure from there. But it only happened in June. Like in July and August, there wasn't wheat procurement, there wasn't availability. So there were a lot of challenges which Anganwadi workers had to deal with in Rajasthan, even though it was centrally controlled, to procure wheat. And there were numerous government orders which were coming out at this point in time to help, actually procurement in wheat, but they were often confusing for the Anganwadi workers. And lastly, I think one of the things which I want to flag here is often Anganwadi workers had to hire their own vehicles to transport wheat from like big sacks of wheat, 100 kg sacks of wheat from the PDS shops to the Anganwadi centers. So it was, and often they were not reimbursed or partially reimbursed for that extent. So a lot of procurement challenges there as well. So here are some of the next steps which we have come up with to address that challenge. First, for Jharkhand, as peanuts and potatoes were missing, so we suggest planning a menu of alternatives which can replace these chronically missing items. Then for Rajasthan, there should be a single source of procurement for wheat, and it should be ensured that wheat reaches there. And secondly, there should be a transport and logistical support which should be provided to Anganwadi workers so they can focus more on delivering the THR to the intended beneficiaries and reaching the maximum beneficiaries. Okay, so let's move on to the third insight, which is on enhancing trust in communication. And this is from our demand side surveys, which we did with the beneficiaries. So we asked the beneficiaries on what are the recommendations which they would like to make to improve the THR program. And two recommendations jumped up. So the first one is they want THR to be delivered regularly and on time, which is a very modest demand, that they really do want a consistent delivery of THR and want to rely on it to plan their nutrition intake for the month and their ration budgeting. But the COVID and all the supply challenges we were just discussing right now has impacted that, and that our understanding is that it is probably a short-term impact for them, and therefore the demand is arising. The second feedback which came from them was to increase the quantity provided. So about half the beneficiaries in Jharkhand feel that the current quantity of THR is insufficient. And in Rajasthan, similar views. They also want to add more items to the THR basket. Our understanding of this recommendation is slightly different, because what we are understanding here is that since these two states are delivering THR in dry ration form, what that means is they're just delivering grains and not any sort of premixes. So what happens is these grains get easily incorporated in your family household ration, and easily being incorporated into the daily recipes and daily staples which everyone is used to eating. What that happens is that you are taking away the quota of nutritious food from the intended beneficiaries of pregnant women, young children, to the other members of the household. So there is larger intra-household sharing. And this situation is actually worsened by the increased food insecurity due to COVID. And therefore, it is kind of obvious that the households will be doing this kind of thing. So when they do this, as you can see the quote here, it says that it only lasts for 2 days for them. All of the household members end up eating it. And therefore, the increase in quantity demand comes in there. But yeah. Let's just talk quickly about the next steps for this particular insight. One of the main recommendations which we are making here is to strengthen the communication on intra-household allocation of THR. So have communication campaigns which educate people on who are the direct and intended beneficiaries of the THR, which is pregnant women, mothers, and young children, and why they would benefit from this nutritious food. And if possible, then adding items to the THR package which can only be consumed by the intended beneficiary, like a premix, which was always there before. But yeah, that I think brings me to the end of my presentation. Thank you so much. If we have any questions, I guess we can take them now.
Great, thank you for that, Aditi. That was really useful to know a lot of information, and we'll jump right into the Q&A session. And so anyone who has a question, you can either drop it in the chat box or please feel free to mute yourself and ask the questions. All right, so this question is from Rachit, who's from Quicksand, and he's asking, what were the reactions from the respective governments on the recommendations given? And were there any actions that were taken already based on these for this current pandemic wave?
Yeah, thanks for that question, Rajat. So while we have shared these findings with the states, as we may understand, these are not normal times, and the survey findings came out earlier this year, and discussing them and implementing them in a short term is not always feasible. We don't have direct actions oriented from the government, but my sense is that Rajasthan government was always looking to add items to the THR basket as the beneficiaries have been asking for. So at the point of our survey, it was just 2 items, but hopefully there have been additional items which have been added since then. And, I think this survey was trying to capture the last wave, but no one expected that this year also there would be another wave. So probably would we give more time to the governments to adopt some of the recommendations and adjust to those, make adjustments to the programming. But that hasn't been possible with the current scenario.
So Somit is asking the next question. What are the key barriers in making it a prepaid system for reimbursement, and why was it not the default way?
Yeah, so I think that is a good question which needs more study on. And we also spoke to some ICDS officers, but not in a detail where you will be able to understand more barriers at a senior level. And I think Alok Arunam is also asking very similar question on the chat. So I think the traditional way in the government is more around filing for reimbursement challans and going through a paper trail and getting it signed. Like, for example, in Jharkhand, it went through at least 5 or 6 officials who had to sign on that challan before being reimbursed. And the reimbursement also came through another organization, which is Jharkhand State Livelihood Promotion Society, which used to further give it to the self-help group. There is a whole chain which is the system which is being followed. And it is difficult to break that system because each of those approvals are necessary to provide that allocated budget for. And therefore, a prepaid system or an e-payment system, which, I mean, there could be challenges with technology in e-payment system, but given the advanced, technology of being able to use offline uploads, offline approvals, it can come in very handy at this point in time where you don't actually need to have the physical files in place to sign those and can approve those things on your tablet or mobile.
In case of proposed supply-side interventions, such as prepaid payments, procurement support, were senior officials' constraints factored in? And next part is, because these suggestions seem genuine and must have been thought through by them.
Yeah, no, that's actually a good question, and I was trying to hint at that as well. That there are obviously constraints at every level of the government, and our survey restricted to the level of the frontline workers and some ICDS officers, but going beyond them would give us more understanding of these. But I think how this was worsened was because of the lockdown and the supply chain constraints which came in with that. So, for example, it was like ensuring that wheat is there in the fair price shops, which normally is for the ration card beneficiaries anyway. But that also wasn't coming out in that scenario. So there might have been deeper supply side problems which were inhibiting this to happen. But I think a more deeper conversation with the senior officials will help provide answers to those.
I will move on to the next question, and I see Durga's hand is raised. Durga, would you like to ask a question?
Yeah, sure. Thanks, Ayushi. So I have 2 questions actually. One is, I see that you mentioned in Jharkhand, SHGs were also involved in procurement. Did you see any comparative advantage, or I'm assuming in Rajasthan, SHGs weren't as actively involved and it was mostly the Anganwadi workers' responsibility. So I just want to understand, between these 2 states, did you see any advantages or disadvantages with having SHGs involved? And that's my first question. The second question is, I think, so I currently work in Telangana for the WTCW department itself. And I think most of the challenges that you talk about are very similar across various states. What I want to understand is a little bit similar to Alok's question, but when we talk about providing alternatives that are locally available, or we talk about ensuring that you're actually paying them for the market price, because these keep fluctuating instead of a standard price that exists. I think these are very logical suggestions, but what we see happens with the department is that at a state level, it becomes really difficult to take care of and accommodate so many different kinds of requests across thousands of Anganwadi centers, right? So is there any, I mean, have you looked at what level of decentralization would be optimal to incorporate some such requests? I mean, even if you've attempted to understand that a little better, I would love to hear your perspective.
Thanks for those questions, Durga. It's a little easier to answer your first one, and the second one is a bit difficult. I guess, I'll come to that later. But on the first one, so a little bit more about self-help groups. So what happens is, what we found that in most of those self-help groups, what was happening is that the Anganwadi workers themselves were actually running the self-help groups. So what ends up happening is that this is a group of women, and Anganwadi workers belong to that community itself. So they form that group because they receive that extra incentive to work as a self-help group. So often it, you can imagine the two models sort of converging. That it is actually mainly the Anganwadi worker who is responsible for procurement as in both. It's just the difference is that here they are free to purchase from the local market, and there they have to rely on the fair price shop owners. So there are pros and cons in both the models, and there have been a lot of studies which discuss more about that. I think the clear-cut pro of having the centralized model, which was followed by Rajasthan, the quality, because they have their production facilities at a state level, at a block level, at much higher levels, and have routine quality audits which allow them to maintain that quality for all the beneficiaries. And it has been observed that when you do decentralization, the quality often deteriorates or is dependent on what the self-help group is able to procure at that point. And then the con which comes in is what we saw here, that when you do local procurement, you are at least able to get whatever is available in the market and give your beneficiaries that ration. Whereas if you are relying on the central procurement, if the supply chain is hampered at a higher level, then the cascading effect follows, and therefore this doesn't work there. So, I mean, all to say, it's difficult to conclude which works better. I think each state has different socioeconomic background, different geography, and have to adapt to these models depending on their programming and policies. And there have been a lot of studies and pilots in this area to understand this better. And quite a few states are doing better in one type of model, and others are doing it better in other types of models. Yeah, so that's my take on the first one. On the second question, I have to say, I think I don't have enough information at this point to add to that, and I guess a lot more research is required, particularly to understand that deeply.
Great, thanks for answering those two. And I think there's another question by Alok. I'll just take that up first. Also, as you have rightly pointed out, that intra-household sharing remains hurdle in access and utilization of THR. Enhancing communication to address intra-household decision-making is definitely a good idea, but working out has constraints. So do you propose how to do it? Also, is there evidence on using pre-mix vis-a-vis loose grains as THR?
So I think on the first question, how to do it, there can definitely be some creative communication campaigns in terms of, having widely vivid, bold posters, or, kind of in the Anganwadi centers, in all the main public areas of the village, of the community centers, where it clearly shows that this THR is meant solely for women and solely for the children, and, clearly identifies the beneficiary group. So that, and along with the benefits, I guess without the benefits, it's difficult to digest for people why they shouldn't be eating the wheat and pulses which are coming in through this additional channel. So having the benefits there, along with the communication campaign, which definitely can have these posters, can have one-on-one meetings, can have home visits, can have like a proper village meeting, especially with the non-women household members, to educate them on who are the right beneficiaries, can support in that. And one other thing which we were proposing in our recommendations was, if if the government wants to keep the dry ration, that's fine. But if there could be a specific item which can be added for, let's say, children, like sweet, and it has colorful branding with like cartoons or some child graphics on it, which clearly indicates to everyone in the household that this is meant for the kid and they shouldn't be eating it. So some creative, communication and branding can help in raising the awareness of the intended beneficiaries on this. On the second question, which Alok is asking around the evidence of premix vis-a-vis loose grains, there are some studies around that, and the nutritionists actually tend to stick with premix because when you have a premix, you can control all the micro and the macronutrients which are supposed to be a part of that composite and are needed for the child and for the pregnant women, depending on the phase they are in. And the age groups, etc., can be controlled easily. So they do want a premix, but the challenges with premix, as are pretty known, are that it gets monotonous. Children do not like the taste always, and for women it used to be a salty premix, so they also don't like that a lot. So it's like taste, non-variety, and not being able to use in different recipes. Like you can only make like khichdi or halwa out of those, like 2-3 things. But with dry ration, you can make a lot of things out of those. So that's why probably beneficiaries prefer receiving dry rations, because it's easier to incorporate in the recipes and it's like staple food for them. But nutrition-wise, it's debatable.
Great. Thank you for answering that, Aditi. I'll just move on to the next question, and this is by Ishwarya. She's asking, from the insights we have, the recommendations suggest an increase in the basket offered. Is this considered for future decision making?
So I'm assuming this question means future decision making for the government. So basically, the increase in the basket offered, as I was saying, the better interpretation of that is not actually to increase the quantity, but to actually reduce the intra-household allocation of that, because the quantity has been set keeping a lot of things in mind which are enough for the intended beneficiaries. That's on the whole quantity, but if you're talking about the variety within the basket, then in Rajasthan, definitely there were conversations and there were strong steps which the government was planning to take to add like sesame seeds, oil, and other important aspects of nutrition which need to go to the basket. A lot of these decisions and a lot of the supply side problems have crept in due to COVID and possibly delayed into the final decision making. But yeah, that's my stance.
Okay, thanks for answering that. I don't see any more questions here in chat. So if you have any questions, please feel free to drop them here or again, unmute yourself. And maybe very quickly, I can also jump in because I had one question as well. And Aditi, this is more from the demand side. And because you mentioned that the Anganwadi workers, on one hand, they were not getting payments on time from the government side, but at the same time, from the communities, they were being pressured by the people. So I'm wondering if, firstly, what was the kind of support system and the support that the community showed towards the Anganwadi workers? Did this impact how they work, and did this impact maybe the retention of the Anganwadi workers? So if you have any thoughts on that.
I think that demands a separate study altogether, Ayushi, because we haven't gone into the details of that with the Anganwadi workers. Like our surveys were more restricted around understanding the supply side problems for THR. And these problems definitely did come up. I have to say that one of our recommendations is definitely to increase transparency between the beneficiaries and Anganwadi workers, and like the system, basically. The beneficiaries need to know that they are not being cheated and they are being given the correct amount of ration they are intended for, and have a clear way of showing that. So one simple thing is to just put a weighing machine in the Anganwadi center, and every time ration is delivered, the Anganwadi workers can weigh that, okay, this is your 2 kgs and here you go. That kind of transparency and trust needs to come in, which may be lacking at points and is resulting in this kind of backlash between the two groups. But I think to understand the exact effect of all of those, I think more detailed study is needed.
All right, so there's another question by Alok, and he's asking, what channels does IDinsight utilize after the research study of this kind to mobilize or persuade decision makers and the audience for whom this research study was intended?
So this study was actually, as I was mentioning in the beginning, was done with Niti Aayog and was a part of our, we worked with Niti Aayog in helping collect data from these two states for monitoring Poshan Abhiyan in these two states. So it was a part of that study and which informs internally within Niti Aayog and in the central government on several decisions related to Poshan Abhiyan. So as I was mentioning, we did 2 rounds of quantitative surveys before this, and those surveys showed a lack of access in THR, and therefore we decided to deep dive into the THR questions through this study. So it was definitely a part of that whole big engagement. And the question which you were asking about the channels, and so as you, I mean, definitely our main intended channel was Niti Aayog. So the officials there and our key counterparts there, and then obviously the states as much as possible. We also try to this kind of platforms of presenting in conferences and writing papers out also helps in providing research decision makers that kind of confidence in terms of the data aspect, and also just collaborating and understanding the views of the other experts in this field, like World Food Program and those who have been researching on THR for so long, to get their views in the study also helps.
I don't see any more questions, but this was a really engaging conversation. And thank you so much for sharing that study, Aditi, and bringing in both some of the demand side aspects, but also a lot of supply side aspects. And yeah, thank you for taking us through that. And thank you for joining us today.
Thank you so much. This has been really useful. Thank you to all the attendees. Very rich discussion. Thanks, everyone. Have a good day.
Thank you, everyone. And one last closing comment. There are more plenary showcases that we have coming up, and also on the 7th of May. So if you'd like to join us, please do visit the online shared event list that we have. But you can also reach out to us on at www.corenet.in or write to us at hello@corenet.in. And we're also live tweeting all the session updates. And you can find us on Twitter at @corenet_India. And again, thank you all for taking our time to attend this session. And again, thank you, Aditi, for taking us through everything. Thank you.